Good morning, everybody. My name is Katie and welcome back to my channel. Today I am walking you through a day in my life of post-surge. So it is 7 in the morning, and yes, I do wake up a lot later than I usually do for this rotation in particular because it starts so late. The rotation hours are 11 a.m. to 9:30 p.m. So I just want some time before I go to bed to unwind, okay? But anyways, I brush my teeth and then I do my hair in my 2 French braids into a ponytail. Then I change into my scrubs and I put sunscreen on my face. Then I pack my lunch, which today consists of a bunch of leftovers. So I have a taco bowl and then I have some mac and cheese, one for lunch, one for dinner. I also pack some snacks as well. And since it's starting to get really cold outside, I'm also wearing a jacket on top of my work jacket while I walk outside so I don't get too cold. I then put on my shoes and then I walk out the door to leave my apartment and go to my car. Now, I'm leaving a lot earlier than I usually do this morning because I had some car issues last night. My battery was dead and my car would not start. So I was kind of stuck at work for a while, which was sad because it was very cold. But here's my moment of truth. You can just hear my disappointment. Anyways, I called AAA and I cooked breakfast while I waited. If my car would have started, I would have just eaten breakfast at work. But since it didn't, I took the time waiting for them to come to eat breakfast at home. About an hour later, the AAA guy came and he replaced my battery. So I made it to work then exactly on time, actually, which is great because I did leave, or I guess attempt to leave, quite early in the morning. So I'm glad the timing all worked out. But I walked into the pharmacy and then I walked up to the 4th floor because that's where we work from on this floor. So in the morning, I messaged the pediatrics pharmacist who covers our shift from 7 to 11 in the morning, which 11 is our start time. So basically we just let them know like, hey, we're on the floor. And then we ask them if there's anything for them to hand off because that way they can sign out of our message group and then they don't have to worry about our floor anymore because we're on the shift now. Then we run both the completed and active vancomycin levels report and then triage the floor. So basically when I'm triaging the floor, I look at when the vanco levels are being drawn and if we have any TPNs. If we do they need any electrolyte supplementation? Because if they do, I gotta do that now because they need it. The TPN itself can wait until a little bit later in the day though. Our TPNs normally start at 1700. Same thing with warfarin dosing. Those start at 1700. So the actual TPN creation and the warfarin dosing can wait till a little bit later in the day. And then on this rotation, we are responsible for the ED and also the surgery patients. So if time allowed while waiting for vancomycin levels, I would also go through the anti-infectives acuity. Basically, when going through this, I would just assess the therapy that they're on and determine if it's appropriate or not in order to, 1, choose optimal therapy for the patient, but 2, also help preserve stewardship so we don't use antibiotics unnecessarily and create resistance. And also while on the floor, I asked patients about any medication clarifications. That way I can get an accurate medication home list for these patients, and then we can continue the needed therapy while they're inpatient. This shift does start really late, so I do take my lunch a bit on the later side, but not too late because we're supposed to take dinner very early, but I generally eat lunch somewhere between 1 and 2 p.m. I saw that they were having chicken parmesan in the cafeteria today, so I decided to abandon one of my pre-made meals and I got that. And I'll just eat my other leftovers tomorrow when I'm at home on the weekend. But anyways, look how good this lunch looks, and it was so inexpensive. I actually really like my work's lunches, so shout out to them. But then I do return to the floor after lunch and I resume my work as specified earlier. We do have huddle for pharmacy on Tuesday through Thursday at 1500 or 3 p.m. However, today is Friday, so no huddle today. But a nice thing about actually sitting on the floor is that like doctors and nurses can easily just walk up to us and ask us questions, which is really nice. There's like a dedicated pharmacist desk, which actually I was the one who sat there. My preceptor sat next to me on like the physician's computer. But basically another nice thing is that I can just quickly go into a patient's room if I need to, if I have any clarification questions or anything that I need to ask them, because we're literally right there on the floor. So we would work on the floor until 1700. And at this point, we head back down and we eat dinner. So that's what I'm mentioning by the early dinner. We do have to get back to the pharmacy at 17:30 because that's when the morning shift leaves. But we do have two 30-minute breaks during this shift here rather than two 15s and 1:30. It just works better with the shift time so that we can eat proper meals. But anyway, here is my mac and cheese that I had for dinner. And then from 17:30 to 21:30, we just take over the IV room shift in addition to any other work that our shift has left over. So for the IV room, we check the compounded sterile preparations that the techs make. We also check the batches that the techs label. And then we tube medications to the respective floor if appropriate. If not appropriate, then we ask the tech to walk it up. And basically, we would split any new start Vanco levels between us and Gen Med. One of my co-residents was actually on her Gen Med rotation, so we just communicated with each other and split the levels evenly depending on our workloads. If somebody had like really heavy clinical shift and things that they needed to work on their floor, you know, the other one would help and take out a little bit more Vanco levels, vice versa. But anyways, after shift today, I did stay a little bit later to fix up these goodie bags that us residents were making for pharmacy week. And then I walked to my car and I left the hospital at about 10 p.m. I then drove home, I took a shower, I put lotion on my face, and I dried my hair with my hairdryer because I don't want to go to bed with wet hair. It is cold and I don't want to get sick. I then flossed and brushed my teeth and put my chapstick on, and then I went to bed at 11:30. And that concludes this week's video showcasing my day in the life of a pharmacy resident in her post-surgical rotation. I hope you enjoyed it, and I'll see you next week for another video. Bye!